The month of May is Melanoma Awareness Month. It is the most common type of skin cancer. It's also the most aggressive, so it is critical to catch it early. We sat down with a surgical oncologist to learn more.
Anyone is susceptible to melanoma. There have been there are known cases of pediatric melanoma. However, it's mostly common in adults. Factors you can look for if you have fair skin and light hair and things like that, and if you're prone to sunburns. So the main preventive measure is to avoid skin damage, and most skin damage comes from the sun exposure, specifically from UV rays from the sun. So really is to avoid sun exposure as much as possible, and if you have to be out in the sun, then you wear appropriate clothing. Or if let's say you're out on the beach, obviously the clothing there is different, then you have to use sunscreen. And also even with sunscreen, be mindful of how long you spend outside. And with the sunscreen, I usually recommend at least SPF 30. And you reapply, if you're out about every hour or so. But melanoma is more common in areas with sun exposure, going with the fact that it is something that usually results from sun damage. However, melanoma has been known to occur in the anal canal, for example. You can have oral melanoma. You can also have melanoma in your toes and your nails. Those are more melanomas in the extremities, or in the hands and feet, I should say, are more common in African Americans. But melanoma really can occur anywhere. Early melanoma, the treatment is surgery, and it could be as simple as just a wide excision with appropriate margins, or depending on how thick the melanoma is, then you may have to have what we call a sentinel node biopsy, which is a sampling of the nodes that drain that part of the body to see if the melanoma has spread to the nodes. And if it has, then it opens up other treatment modalities that are recommended. There's a common acronym which is ABCD, which everyone would be familiar with, and this goes to some features about the melanoma. The A stands for asymmetry, and really it's looking at the lesion in the skin to see if there's any asymmetry between one side versus the other. B is for the borders, and usually the borders are irregular and not nicely well defined, and those could also be elevated. Then C is for color, and usually it really speaks to color variation. So if you have a lesion that has different colors in different areas, that should be concerning. And then D is for the diameter. Usually if anything is more than a centimeter, that's also kind of a red flag. That's something you should be concerned about. And lastly, E is for elevation. And if a lesion, usually non-melanoma lesions are flat. If you have a lesion that's kind of raised and elevated above the level of the skin, then that should also be concerning. So if you notice any of these features in a skin lesion, you should see a primary care physician or ideally a dermatologist for screening.